Hi everyone, I'm Natalie from MyProgression. Picture this, you're a teacher at school and you have a feeling that one of your pupils may be suffering from anxiety, but you're not sure how to approach the situation. What do you do first? Can you recognise the signs of anxiety? What do you say to them? Stick around because in this video we're going to cover the telltale signs of anxiety in children and how you can support your pupils. This video is the first in a series about intervention and is following on from our earlier video on the 6 stages of a crisis. Remember, MyProgression offers CPD certificates to allow you to evidence your learning. See the description for more information. With mental health being such a prevalent topic, I'm sure you've heard of anxiety and what it means. In fact, prior to the pandemic, it was estimated that anxiety affected between 5 to 19% of all children and young people, which meant that in the classroom, there may have been up to 5 children struggling with anxiety of some sort. What we mean by anxiety when talking about children and young people is defined as any change in normal behaviour. Firstly, it's important to know that anxiety is a normal human response to stressful situations, and in children and young people, it isn't always a problem. In fact, some level of anxiety can actually be helpful to assist in the development of their fight or flight system, so they're able to react quickly in potentially dangerous situations. If you go into any school during exam season, the majority of children will be feeling anxious. However, a small number might feel so overwhelmed that they actually can't face going into school that day. Now, if you work on supply, it can be really difficult to spot if a young person is anxious because you might not know how they normally behave. We're going to go through some of the emotional and physical signs that someone is suffering from anxiety so you know what to look out for. So, signs and symptoms of anxiety. When young children feel anxious, they can't always understand or articulate how they're feeling. So it's important to be aware of how they're behaving and take note of any patterns you see. Symptoms of anxiety are often missed or just dismissed as nervous behaviours, but these can escalate extremely quickly if the child or young person's needs aren't being addressed, so early intervention is vital. You should be looking out for signs such as irritability or becoming agitated quickly, pacing up and down, fidgeting with their stationery or tapping their pens, clenched fists or tight hunched shoulders, difficulty concentrating or feeling overwhelmed, wringing their hands, avoiding eye contact, withdrawal. Some children may also express their anxiety through challenging behaviour in the classroom. The recommended approach is supportive communication. How you react will directly influence the outcome. You should always attempt to remain calm no matter what. Our video, Calmer Communication, Body Language Tips for Teachers, provides helpful ways to manage your own mindset and remain calm. So check that out after this video. And whilst you're there, like and subscribe to keep hearing more from MyProgression. When you notice a child or young person in your care is demonstrating signs of anxiety, we recommend that you take a caring and non-judgmental approach. This might be just as simple as saying, "Is everything okay? Is there anything I can help you with?" You could be the first person they've spoken to all morning, so hearing a friendly, supportive voice might just be enough. It's important to really listen and validate the person when you're supporting them. Being aware of communication skills is vital in order to respond appropriately. We're now going to look at communication types and how these can be implemented in the classroom. Verbal communication includes the words you choose to use to convey a message. When talking to a young person who might be anxious, you should aim to keep the messages short, simple, but most importantly, phrase your words positively. For example, let's say you notice a child is getting agitated about their maths work. You've already explained the problem a few times, but it's clearly not going in. You see they're sat back in their chair, they're fidgeting, just staring out of the window. Instead of saying, "I've explained this twice now, get on with your work please," you might say something like, Let's take a 2-minute break to refresh our brains, and then when you're ready, we can sit down and do this together. How does that sound? This is much more positive and supportive and shows the young person you're there for them. As well as the words you use, consider how you deliver the message. Use caring, supportive tones to show empathy and keep a consistent volume, and talk slowly so they can process what you're actually saying. Finally, listening and validating the young person when they talk to you is crucial so that they feel heard. When responding to a young person who's anxious, keep these points in your mind. Give your undivided attention. If you're clock watching as you've got another lesson in 5 minutes whilst they're talking, this could cause them to shut down. Listen to both facts and feelings. It's important to discuss both of these in order to identify the best way forward. Paraphrase back to them to ensure you fully understand. And give them a chance for silent reflection. And use this time to reflect yourself on how you've managed this situation. By responding appropriately, this strengthens the trust between you and the individual and helps to build rapport. By taking the time to listen, you're showing them that you value what they have to say. Remaining calm and consistent in your own mind and body language is vital. And practicing your own communication techniques is key for this to work. If you found this video on dealing with anxiety behaviours useful, then send the link to someone else who also might like it. Sharing knowledge and resources will help everyone perfect their craft. Look out for our next video that will focus on verbal intervention for defensive behaviour. I've been Natalie from MyProgression, and let's keep your career in motion.